Hello, friends. This is Dr. Queen Aditya. I'm a gynecologist based in Kolkata and have been practicing for several years, more than 20 years now. And I welcome you all to this program. This is just to refresh our knowledge and our concepts about calcium that is required uh, by everyone, especially by women in various phases of their life. First of all, during adolescence, because of the growing, the need of the skeleton. As we know, most of the calcium in our body is in our bones. So the growing skeleton, as we gain height during the teens, we need a lot of calcium. During pregnancy, we specifically need a lot of calcium. We have to take care that we have adequate amount of calcium in our system. That is because the growing baby will pull the calcium out of the mother's system, and thereby the mother will fall sick. And when the mother's bone becomes deficient or less amount of calcium is there, then the bones become weak and brittle, and that can give rise to a lot of things. And children, when they have brittle bones, then it becomes rickets, and in adults it can give rise to very weak bones and osteoporosis later in life, something called osteomalacia. These are all different forms of diseases of the bone that happen because of lack of vitamin D and calcium. Both of these go hand in hand, as we all know. But what is important is that calcium is one of those nutrients, one of those minerals that women really need. Obviously men also need it, but women in various stages, as for both the growing boy and the growing girl in adolescence. And we are mostly concerned with the pregnancy, because the baby, the growing baby, the fetus is going to pull a lot of calcium from the mother's system, so that the mother does not suffer from low calcium levels, giving rise to problems in the bone, and also so that the baby is not deficient in calcium. That means the baby has adequate calcium. We have to ensure proper dietary calcium intake and also supplementation. Also, throughout the years, the menstruating years, also we need calcium just to maintain the levels that are required by the system to maintain the bones. Because as we know, we must understand this, that bones are formed and they are broken. Not, I won't say broken, it's something called resorption. Like little tiny pieces are being formed and tiny pieces are getting destroyed. That is called resorption. So for this process, we continuously need calcium into the system. The old calcium also goes out through, gets excreted out of the system, but we need calcium at a constant rate. And so every day we have to have an adequate amount. The recommended daily allowance is around 1,000 milligrams, that is around a gram. And it's around a gram and per day. And in the growing years, it might be more, 1,200 up till 18 years, they say it might be 1,300 milligrams per day. And also after menopause, the requirement of calcium goes up. Even in pregnancy, though it said 1 gram, ideally 1 to 1.5 grams should be taken. But there is something called a hypercalcemia, where too much of calcium in the system can give rise to other problems along with kidney stones. So we have to take care that we are not overdoing the thing. So before going in for any kind of calcium supplementations, you should obviously contact your doctor. And obviously during pregnancy, nowadays I don't think there is anyone who will pass through a pregnancy without consulting your doctor. Doing things on your own, nowadays hardly anyone does that. So whenever you're visiting your doctor, your gynecologist, they will definitely suggest calcium supplements for you. Now after menopause, or during, as the periods stop around 50ish, 48 to 54, that age group, when the periods are stopping, what happens is that there's what we have a natural, called a natural menopause. And in that menopause, what happens, the ovarian function totally stops. That is, the ovaries stop functioning. Thereby, we lose the capacity to procreate. That is, capacity of childbearing. That also we lose. Along with that, a very important thing is that the ovary secretes estrogen hormone, and that estrogen hormone is very essential to our femininity. And not only it makes us look good, it helps us, it protects us. And one major role it plays is on our bones. When it helps in the formation of bone. As I told you, there are two things. One is called the formation and one is called the resorption. It will stop. It will prevent the resorption. That is, too much of bone is not getting destroyed because of the protective action of estrogen. After menopause, the protective action of estrogen is lost. Thereby, there is resorption, what I call as tiny breaking of the bones, and thereby our bones become brittle, weak, and later in life, many women suffer from osteopenia. That is when the density of the bone goes down, and osteoporosis is when the density of the bone is really low. And at that time, because the density of the bone is very low, it is prone to fracture. So we all know, maybe in our families, in our friend circle, we have heard of some elderly woman who has tripped and fallen and has suffered a lot because of this. But it's actually the other way around. It's because her bone is brittle, her bone is not dense enough. That is why it could not take the capacity, it could not take the burden, and therefore it broke, and thereby she fell down. So it's not always that she fell down and the bone broke. It is the other way around also, that the bone is brittle, it is not strong enough as it should be, and thereby it has broken, and thereby she has fallen. This is something that I think everyone needs to understand. Now, during pregnancy, as I mentioned, there is a tremendous need for calcium. Yes, in normal households, we take a lot of milk products, and especially in pregnancy, I think the elders in the family are quite aware that we have to take a lot of calcium in our diet. So they will ensure that we take enough curds, we take milk, other milk products like paneer and cheese and all that. So that is very good. Soya is also a good source of calcium, and also some of the vegetables. Most of the green vegetables are also quite rich in calcium. Thereby, in most of the cases, adequate diet is also good enough. But during pregnancy, maybe the need that is there because of the growing skeleton of the baby, that is not, it will not be fulfilled by diet alone. And thereby, by the rule of the thumb, even the government of India is in the guidelines about calcium in pregnancy, they are recommending usage of calcium in pregnancy at least from the 14th week till 12 to 13 weeks. We call it the first trimester. So once the first trimester is over, from the second trimester, the government of India guidelines also tell us to start calcium and to continue that till at least 6 months after the baby is born, because it is assumed that in most of the cases the baby is going to take the mother's breast milk. So in that case, the mother again is going to lose milk, calcium in her breast milk, and thereby to protect her, we have to supplement the mother with calcium, even in both in pregnancy and in lactation. So it will be 14th to 40th week of pregnancy, and immediately after childbirth till at least 6 months when the mother is lactating. That is when the mother is breastfeeding the baby. So these are very important things we have to know. You might ask us that why not before 14 weeks? The reason is not very clear now. It is actually quite vague. What I want to tell you is that there is no harm if calcium is given earlier. But in most of the women, in the first 2 to 3 months, there is a lot of nausea and vomiting. So anyways, any medication that we give them, they cannot tolerate. And calcium tablets are usually large in size. So that can also give rise to a problem that ways. So thereby, taking it in the first trimester really does not serve any purpose, because why we basically need the calcium is that when the baby skeleton is growing, and the skeleton usually in the first 3 months, the baby hardly is very small in size and the skeleton is hardly there. It starts developing big time after the 12th or 13th week. So that is why the rule is that start calcium around 14th to 16th week. Latest by 16th week, we give the calcium so that the growing skeleton of the baby, the calcium that it takes away from the mother does not suffer. Because even if the levels of calcium in the mother is low, the baby usually has an active process by which it can enable itself to pull the calcium out of the mother's body. So therefore, what happens is that the baby usually does not suffer that much. It is the mother who suffers because of lack of calcium. So this is a very important factor that we have to keep in mind. Usually, even we have seen that in very poor families, households, the baby usually is grown enough. The size of the baby is okay. The bony structure is okay. It is the mother who suffers. So to ensure that both the mother and the baby
are healthy, we have to supplement calcium to the mother, ideally from 14 weeks. But as I said, if anyone wants to start calcium before that and is okay with it, does not have too much of a problem, then we can start calcium earlier also. But the rule is that we start from the 14th or the 16th week and continue till 6 months after delivery, as I mentioned during breastfeeding phase. Now we have a few questions. Just let me go ahead with them. What happens if you don't take calcium during pregnancy? This is the same thing that I have just discussed. That is, even if we do not take calcium, the baby might suffer to a small extent, but by and large, the baby is going to extract calcium out of the mother's system. So the main person who's going to suffer is the mother. So we do not want that to happen. The baby might suffer to some extent. Suppose the baby suffers 10%, the mother will suffer maybe 40 to 50%. And it'll be the mother who will become weak. Less calcium in the system will cause the bones to become brittle. There can be a lot of backaches and all. And later in the later months of pregnancy, or even after childbirth, when the mother has a lot of work to do looking after the child, the mother can be very weak because of the brittle bones. So that we have to prevent that. So I'll go to all the questions one after the other. What is the role of calcium during pregnancy? As I said, there are other roles of calcium during pregnancy. Very good question. Now, one I mentioned is that it is basically the main need was to supplement the mother because the baby is extracting calcium out of the mother's system. But now there have been found certain advantages of calcium, usage of calcium during pregnancy. That is, calcium has been found to prevent certain complications that are inherent to pregnancy. One is something you might have heard of, something called a pregnancy-induced hypertension. That is blood pressure becoming high during pregnancy. That is a condition that we all fear. The baby can suffer, the mother can suffer. We might have to take out the baby early to save both the mother and the baby. That is called PIH, or pregnancy-induced hypertension. That is a condition that to a great extent is avoided if the calcium levels are adequate. So women who are suffering from calcium, lack of calcium, those women will suffer more than women who have an adequate level of calcium, that is with supplementation. Then there's something called preterm labor, when there is a premature birth. Premature birth also to some extent has been controlled by the adequate levels of calcium. So when the calcium supplementation is there and the levels of calcium in the body are normal, then usually the possibility of a preterm labor goes down to a great extent. Then the calcium also has been found to increase the birth weight of the baby. So the mothers who have an adequate or a normal calcium level have had babies whose weight is comparatively more than mothers whose calcium level was less. Moreover, calcium has also been found to prevent this condition called postpartum hemorrhage that we gynecologists really dread. Postpartum hemorrhage is that immediately or a few hours after delivery, if there is severe bleeding from the uterus, that is called postpartum hemorrhage, and which is we have to very proactively treat that and stop the bleeding. Sometimes we have to give blood transfusion. Unfortunately, some mothers are lost also because of severe bleeding. So proper calcium in the system, proper levels of calcium in the system has been found to prevent this postpartum hemorrhage to a great extent. So I'll just go through the other questions. What trimester is calcium most important? The most important time or trimester for calcium is the third trimester because there's maximum skeletal growth. And so it has been found at 20 weeks, probably the baby extracts around 50 milligrams per day from the mother. And in the later weeks, 34, 35 weeks, it goes up to around 300 milligrams per day. So 50 milligrams at 20 weeks to 300 milligrams per day at 35 weeks is showing that in the later part of pregnancy, just pre-birth, in the last few weeks, actually there is a lot of calcium that is drained from the mother to the baby. So we have to ensure that the mother is having adequate calcium in her system. That is by supplementation in that phase. Sonam Patel is asking, is it necessary to take calcium during pregnancy? As I've already mentioned, in very poor families, we have seen that they don't take any supplementation. Not only poor, maybe ignorant families, they do not take supplementation. The baby might suffer to some extent, but the mother is going to suffer big time. All of these complications can be prevented by adequate levels of calcium, as I have mentioned, pregnancy-induced hypertension, preterm labor, postpartum hemorrhage, and adequate birth weight of the baby. These things can be we can ensure these with the adequate levels of calcium. So specifically to pregnancy, calcium is important. Moreover, the baby skeleton is extracting calcium from the mother system. So the mother will become deficient in calcium, will lack calcium, and can suffer from all the bad effects due to the absence of calcium, and thereby we have to supplement. There is no option but to supplement calcium in pregnancy. Madhavi has asked, if I'm taking nutritional foods daily, then need to take calcium supplements. The thing is that this is rather tricky, because whatever nutritional supplements you are taking, you have to check the composition, and if there is adequate amount of calcium. If I assume that you're taking milk, curds, cheese, paneer, all of this in adequate amounts, then probably you are getting some 500 milligrams or more per day out of that. But you need a minimum of 1000 milligrams for everyone. We need a minimum of 1000 milligrams per day. So if your nutritional supplement has 400 to 500 milligram of calcium, and you are taking adequate amounts of milk and milk related products in your diet, then it is okay. Then you do not need an added calcium. But when you cannot ensure that you are having adequate intake in your supplement as well as your diet, then you will need a specific calcium supplement. Kavita is asking, can we take iron and calcium together during pregnancy? Yes, absolutely. Yes and no. I'll explain why. In pregnancy, we need both iron and calcium. Iron is an absolute must, so is calcium. But the problem is that iron absorption is hampered by the presence of calcium. So what we do is that we give iron and calcium at different times. We need both. But we cannot give them together. I have had a lot of patients who did not follow these instructions. They've been taking iron and calcium together, and later on when their tests are done, suppose the hemoglobin was low, 9, and we expect that after proper supplementation, it will go up at least to 10.5 or 11, and we see that the hemoglobin level is still low. Then we ask them, when have you been taking them? And so quite often they say, for convenience sake, they have been taking them together. But if iron and calcium are taken together, calcium actually prevents the absorption of iron, and thereby, though you're taking both, the effect of neither is going to be there in your system. So whenever you're taking iron and calcium, specifically in pregnancy, when both are recommended and are advised and are prescribed by us, then it is mandatory that you take them at different times. Rebecca has asked, is calcium supplement necessary? As I mentioned, in non-pregnant state, before pregnancy, that is in your suppose 20s, 30s, 40s, whenever you're in non-pregnant, we still need calcium supplements when our diet is not adequate. But otherwise, when we are taking enough of milk products, dairy products, then probably in the non-pregnant state, we might go without calcium supplements. But as I mentioned, in pregnancy, because of the growing skeleton, which extracts a lot of calcium, we absolutely need calcium. It is an absolute necessity. And also post menopause, when the protective effect of estrogen is not there anymore, then the bone is slowly breaking. As I mentioned, miniature, it's called resorption of the bone, and because of that, we are losing our bone is falling weak. So we have to give adequate amounts of calcium, more than 1 gram, probably 1.2 or 1200 milligram or so. Symptoms of calcium deficiency in babies, as I mentioned, is usually not very prominent, because as I several times I've told you all that the baby has this unique capacity of extracting calcium from the mother. So though the mother has a lack of calcium, most of the calcium of her system will go to the baby. So if the baby suffers, it will be very minute. But if the symptoms of calcium lack will be, the baby can be, not very alert. So you can see it's a drowsy baby. The muscle contractions might be poor. If these things are noted, then the pediatrician or the child specialist does advise for a serum calcium level, a blood calcium test, to see whether the baby is lacking calcium. But as I mentioned, the possibility of the baby lacking calcium is actually quite low, because the baby has this unique capacity of extracting it out of the mother's system. Yes, Lakshmi is asking, which fruit has the most calcium? This we have done even in school. Some fruits are very, very potent in calcium. One is that we call that, what do you call it? Sitafal. It's called custard apple. And then also guava. Certain fruits do have calcium, but not to a great extent. So relying on fruits solely for calcium is not a very good idea. Dairy products is a better idea that way. Folic acid, Lakshmi again has asked, can I take folic acid and calcium tablets together in pregnancy? There is actually no contraindication to taking folic acid and calcium together. But as I mentioned, iron and calcium should not be taken together, though there is no benefit of taking folic acid. And what I tell my patients is to take folic acid, iron, calcium, all of these at different times. And calcium ideally, because the recommended daily allowance should be more than 1 gram, and it has been found that up to 800 milligram probably is absorbed well at one time. So usually what we do is that 2 tablets, if it's a 500 milligram calcium carbonate, we give it as 2 tablets per day to be taken at separate times. As for example, after breakfast we ask for a folic acid, then between breakfast and lunch, 2 hours after a meal is the best time for iron. So between breakfast and lunch we go for the iron. After lunch go for 1 calcium tablet. After dinner go for another calcium tablet. That is the best way to go about it. Calcium, iron and folic acid to be taken at separate times. That is the best way out. So another question is that when should you take calcium, morning or night? The same thing I would say, that you can take it after either meal, but when we are taking 1000 milligram dose, then it is better to take it in 2 divided doses, because more than 6, 7 or maybe more than 800 milligram is not absorbed very well together. And when we are sure that our diet is sufficient in adequate amounts of calcium, then when we are going only for a 500 milligram single tablet, then we can take it after any meal. But taking it in empty stomach usually causes a lot of bloating and discomfort. It can cause gastritis, bloating and discomfort. So ideally calcium should not be taken in empty stomach. Yogendra ji has asked whether dose of calcium is 500 milligram OD or BD. As I said, ideally it is BD, because only when we are very sure that our diet or other supplements have adequate amounts of calcium so that we do not need too much of extra calcium, then only we can be liberal enough to go for only an OD dose. But when we cannot ensure that our diet has adequate amounts of calcium, then we have to go for the BD dose, because we need a 1 gram dosage. And as I mentioned, 1 gram together, usually the absorption is not too good. In that way, sense, we go for a 500 milligram BD. So you are quite right, Yogendra ji, when you ask whether 500 milligram OD or BD, BD is the better option. Jenny is asking what can be done to improve the bone strength. Yes, to improve bone strength, what the best thing to do is proper exercise. That can be under a proper training, or you might ask someone who is eloquent in that to give you an exercise regime. Along with that, a nutritious diet which is rich in calcium and other vitamins and minerals. You need adequate vitamin D. For that, exposure to sun is required. If you feel it is better, if you do not want to take a chance, once get your vitamin D levels done. It's 25 hydroxy vitamin D test that is done, and if it is below 20 nanograms per ml, then we will need vitamin D supplements. Nowadays, very good nano supplements are available. They come in nano forms, usually in the liquid version, and the dose is usually 60,000 units once a week for 2 months, and then once a month for a year. So when your levels are lower than 20, it is better that we go for vitamin D supplements as well. And calcium, as I mentioned, if your diet is not does not have adequate amounts of calcium, then you should go for the supplementation as well. Varsha, what is the role of calcium in daily routine? As I said, our bone is undergoing wear and tear every day. So the bone that is getting resolved, the calcium goes into the system, part of it is excreted. So to make up for that amount that is going out of the system, we need more calcium in our system. So that will come through our diet, because the body cannot manufacture calcium. That is something that we have to take from external sources. Our body does not have the capacity to manufacture any of these minerals. So minerals, we are solely dependent on the external sources, and the only source that we have for calcium will be our diet. It has to go through our gut, through our mouth, and thereby we have to have it either through an adequate dietary intake, or we will need supplements. Do babies also require calcium when pregnant? As I mentioned, I think this question I have described in detail. When babies are in the system, in our system, they have this unique and wonderful capacity of taking the calcium from the mother and thereby ensuring that their skeleton grows adequately. If the mother is severely lacking in calcium, the baby will get less calcium, but still the baby will get much more compared to what the mother is losing. So the mother will lose a lot. So the main sufferer in this case, when the adequate calcium levels are not there, will be the mother. So, but we need a healthy mother to have a healthy baby eventually, and thereby we cannot compromise on the mother's health, and thereby we will need the mother to have adequate levels of calcium both for her and for her baby. And so before we end, I would like to add one more thing, is that we are talking about pregnancy and childbirth and post childbirth, that is lactation. When the mother is feeding the baby, then also, because the calcium is going to the baby through the milk, thereby also the mother will need adequate levels of calcium, and so the supplementation has to continue beyond delivery, at least till 6 months when the mother is feeding, because after 6 months we can reasonably assume that the baby is going to get some other mode of nutrition, that is, will have top feeds, will have other cereals, and those kind of things will be started. Like we in our community, we have an annaprasana at 6 months, the rice eating ceremony. So other feeds are also started, but till 6 months we assume that the baby is totally dependent on the mother. Thereby, till 6 months, when the mother's milk is draining out the calcium from her system, she will need calcium supplements. So that is there. The other thing is that during adolescence, when a girl is growing, then her skeleton is also growing, so she needs more and more calcium. So probably in that age group, they will need more calcium. We do not pay too much of heed to it. If the child is having adequate milk and dairy products, probably we do not need supplementation. But when our children are not taking adequate amounts of dairy products and substances that are rich in calcium, in that case, we will have to give our children calcium supplementation. This is something that we have to think about. And also the women in the menopause, post-menopause, perimenopausal age group, when the protective effect of the estrogen hormone from our system is lacking, then the woman is very susceptible to suffering from brittle bones, which is called osteopenia when it is moderate, and severe when it is severe, it's called osteoporosis. So in that situation, when there is osteopenia and osteoporosis, we have to prevent that, and to do so, we have to give them adequate levels of calcium. And in case the dietary intake is not good enough, again we have to think of adequate supplements. And as I mentioned right at the beginning, that we have heard of elderly women tripping and falling and having fractures. Mostly it's because the bone is brittle, that is, the woman is suffering from osteoporosis. For that reason, she is her bone is breaking, and because of that she is falling. So it's usually the other way around. We have to prevent this. This is a huge burden on the society, because a woman who has a good number of active years, even in her 50s, 60s, 70s, if she is suffering from an osteoporotic fracture, it is a huge loss to her and her family and to the society at large. This is a problem that we should be able to prevent by looking into her the levels of calcium that she has, and to prevent her from suffering from lack of calcium. So I think if there is any other question, I'm free to take it. Otherwise, I hope you all have had a recapitulation of this very important topic called calcium, which we all know. We keep reading about it everywhere, but the main important points that comes from a doctor's thoughts, that is the things I have spoken about, and I hope I have been able to answer your questions. And so then if there is no other question, then should I take your leave? Okay, thank you, friends.